Hello, I'm Yula Kim with HIMSS and welcome to today's webinar. I have a few announcements before we get started. If you need technical assistance during today's event, please type your questions into the questions box, which is located to the right of the slides window, and click the submit button. You can use the same box to submit questions to the speakers at any time. And if we don't get to all your questions today, we will try and follow up with you offline. The questions box has multiple tabs where you can view any webinar handouts if available, as well as the abstract, speaker information, and access your certificate of completion. Finally, you will receive an email by the end of the day with a link to a replay of this webinar as it becomes available. So now I'd like to introduce you to today's webinar, Designing for Success, a Blueprint for Digital Technology-Led Remote Care for Expecting Mothers, sponsored by Harman. Our speakers today are Mr. Manish Basin, Director of Product Management at Harman, and Ms. Fran Ayala-Somayajula, President at Reach. With that, I'll hand it over to you, Fran.
Hi, everybody. I'm Fran Ayala-Somayajula. I'm the President of Reach. Reach is a 501c3 global social impact organization. I myself have over 25 years in the industry as an epidemiologist and public health professional. I started my career working with organizations that included the World Health Organization and CDC. I've spent almost 2 decades now, combining my discipline within the area of public health with technology and really honing in on the value that digital health can bring and addressing some of the most persistent challenges that we see in the industry. One of the things I would like to share as we get started is that Reach is very proud of being a member of the American Heart Association Innovation Network. It is through this relationship that we've been able to introduce a program that not only is comprehensive, but also incorporates their care plans for addressing such issues as cardiovascular disease and diabetes. As well as we are advocates of the Release the Pressure in the American Medical Association. And it's with the combination of these types of collaborations that we were able to really identify a way of addressing a need, but we knew that we needed a very strong digital technology partner with us in this journey. And it is with that I'm proud to say that we have partnered with Harman, and we're very honored to be able to present to you a solution that was developed through the combined efforts of our teams.
Hi, hello everyone. My name is Manish Basin, and I'm Head of Product Management for the Harman Digital Transformation Solutions Division. I've been in the industry for over 2 decades now, and I've worked in communication and digital technologies throughout that time. I'm a technologist at heart and like to see how technology can make a difference. Very proud to be working with Reach as our partner in the maternity care space and using the Harman connected care offering, specifically our Harman remote care platform, to power the happy mama vision that Reach has laid out for us. Very, very happy to be here today.
For many of these women, this sudden transition begins to occur 6 to 8 weeks prior to labor. Like that's when you should be watching the closest. It could have been, happenstance that every other time that they had gone in for their prenatal checkup, that their blood pressure checked out just fine. But that continuity of care isn't there because no one's continuing to monitor that patient and is not necessarily monitoring that particularly as close as they could be.
It's like a silent killer of women that just has gone unattended to, I guess you'd say, for decades.
Now, for me personally, I think digital therapeutics is a route and a move ahead. Because if you want to look after your population health from 1 to 3, how soon can you actually go from 1 to 300 or to 300,000 people, right? And that is through the most evidence-effective, intelligent information is through your digital technology.
So given that the majority, 98% of women in the U.S. do deliver in a hospital, how can hospitals do a great job, a phenomenal job of giving patients the information they need before they go home? And then once they're home, how do we connect with patients to make sure that they're okay after they've gone home?
The value in starting off today's presentation with this video is to really sort of set the stage in terms of what we're going to be focused on for the next few minutes with you. And we're really honored to have this opportunity to present to you. I think, however, that we should back up and begin by first taking a very global look at the reality of what's happening. Every minute around the world, a woman is dying as a result of complications during childbirth or pregnancy-related issues. And in fact, the statistics show, as you can see on the screen, that this is a far-reaching. In fact, even in those areas where you see to the right, the maternal mortality rates giving the indication of green or evergreen color, don't be fooled by those. There's still women who are either dying or in fact being injured. In fact, for every injury, for every death, there are thousands of injuries that are occurring. And these numbers are quite alarming. Certainly, it should be acknowledged that in developing and emerging markets, the rates of mortality are higher. But it is also a reality that these challenges are challenges that are even faced right here domestically in the United States, where we see the rates of maternal mortality increasing while those rates, even in developed countries, are beginning to decrease. But still, at the rate at which we're having success, it's not sufficient to be able to address some of the challenges that we are facing. REACH is a 501c3 global social impact organization. And addressing the issues of maternal mortality and morbidity is one of the areas of top priority for our organization. So I'm going to talk to you a little bit about the data, what we have seen in our research, and then we'll move on to proudly introduce to you some solutions that we propose, and one major one on this Happy Mama, which will be presented by my colleague, Manish from Harman. So let's take a moment to talk a little bit about these severities that I mentioned earlier. In the United States, as the data had previously shown, we know that there are as many as 800 to 900 women whose lives are lost during complications of pregnancy, many of which we've identified as not necessarily happening during labor, but actually during postpartum. And that for every one of these deaths, there are approximately another 10,000 women who suffer from severe injuries. This has major impact on the mother, the child, the family, and even potentially the economic status of the family itself. I'm going to give you some hard statistics to look at by beginning by telling you the story of 4 women. While you may look at these pictures and see some superficial differences, perhaps in their race and ethnicity, there are a lot of commonalities amongst these women. The first of which is that all 4 women had actually complained of having complications or feeling as though something was just quite not right during their pregnancy. In fact, Lauren, in the lower right-hand corner here, right-hand quadrant, you can see beautifully smiling upon her baby, was a NICU nurse. She actually gave birth in the same hospital where she was employed. And while with her own education as a nurse led her to recognize that her signs of headache and high blood pressure were indications that something was wrong, she was not listened to. The testing didn't occur that needed to happen for her. And by the time, after multiple insistence upon by her and her husband, the hospital decided to conduct testing, it was too late and she died of a cerebral hemorrhage. Or we can take the examples of other women, such as those Native Americans who previously had histories of complications in their pregnancies and who had presented. And while in the process of seeking care, had transferred from facility to facility, did not receive any resolve or direct addressing of the issues that she was having. What this led us to identify, and many attest, not only ourselves, but groups such as the March of Dimes and many others, is that there are essentially 4 main delays that are contributing to the complications and ultimately contributing to severe morbidities as well as mortalities. And these are delays in transportation, getting access to facilities, delays in seeking care when individuals aren't familiar with the signs and symptoms, delays in diagnosis and treatment as well are all major causes contributing. In fact, these issues constitute 75 to 80% of the challenges that are contributing to deaths. On the one end, this is a tragedy. On the other end, we have the opportunity to look at this as an opportunity. That when we take this knowledge that we currently have today around the value of connecting, communicating, and collaborating, that we can address some of the issues that are in fact preventable, such as those I described earlier of knowing the signs and symptoms. Our ability not only to hear and listen and respond, but actually to have a path of escalation for when things are going wrong, to ensure that data is being shared across a multidisciplinary team and that preemptive protocols are taken into account. Another key component is the continuum of care. As I mentioned earlier, for many women, particularly in Western countries, developed countries, is that these challenges present after delivery. And so it's very important that we continue to watch women postpartum, particularly in the first 3 to 6 months of post-delivery. But even complications associated with mental health and well-being become particularly important, which is why many have proposed that we continue to support women as far out as 12 months postpartum, and that we work diligently to ensure that every member of the care team, lower skilled to even the highest skilled specialists, that we are ensuring that they are getting the skills that they need in order to be able to more efficiently and effectively support women throughout their pregnancy. These skills include a knowledge of the value of digital technology and how to appropriately integrate digital technology into care plans for pregnant women. And during this presentation today, we will talk a little bit more about what best practices look like and tools that can help to address the challenges that are being faced. But before we get there, I'd like to talk to you a little bit about some research that REACH has conducted. Earlier this year, we had released information about a study that we conducted of over 900 women in which they were asked to share with us their attitudes, perceptions, and behaviors related to their pregnancy. And we asked them questions in relation to their knowledge about certain comorbidities that may exist during pregnancy. What we found is that, in fact, many of them were not familiar with some of the dangers that relate to high blood pressure during pregnancy, and that many felt that related topics such as anemia and even diabetes were things that they were not familiar with, and that the information that they may have received from their providers was insufficient. The research further went on to describe how the clinical information that they felt that their clinicians had about them was actually insufficient, and that oftentimes that there were situations or scenarios that were arising during their pregnancy that they felt were being overlooked by their clinicians. And this led ultimately in our data finding that many women would like to have access to digital tools. Even during the pandemic, one of the things that became very apparent and was actually a featured study that REACH had conducted was that while telehealth tools, as an example, were being used for other conditions, the area of maternal health was an area where there was not great adoption by obstetricians and gynecologists and other maternal health care providers. And as we dug a little deeper, the finding was, and in fact, they weren't familiar with the tools, and that there were questions regarding how they would go about the process of reimbursement. So these are all things that REACH is very proud to be able to announce that we're here to support with, and that we have introduced very simple technology that can be introduced so that quotes such as the quote that's presented here on this slide are addressed directly, and that women don't have to have the fear that many often have about the progression of their pregnancy, particularly when they may have had previous complications in other pregnancies. Because we know that pregnancy is dynamic, that no two pregnancies are alike, and that in fact, the needs of women throughout their pregnancy and postpartum change over time. And it is throughout this sort of progression, if you will, into what we refer to as the tender moments of motherhood, that we need to pay particular attention and need to create for ways for providers and for expectant mothers and new mothers to be able to better communicate with one another. As an example, some of the concerns that women have in the beginnings, phases of their pregnancy are oftentimes associated with their own general well-being. And that as their pregnancy progresses, that they begin to focus more on issues related to the healthy development of their child. And that by the time they move into the later stages of pregnancy, there's this emphasis on the labor and delivery. But there's one area of scope that is often left out, which is known as sort of this fourth trimester, if you will, which is this postpartum period, in which there are many additional questions that come to mind for women that we need to take time to have particular emphasis on and ensure that women have access to resources that can support them. Some of these are related to health conditions, and others are related to their adjustments, both social, economic, career, family, and childcare related as well as an area which often gets overlooked, which is their mental health state. So let's talk a little bit about this social economic impact that can happen as a result of complications with pregnancy, and equally become compounded when we look at some of the realities that exist with pre-existing conditions. The reality is that in the United States, and unfortunately increasingly rising in other countries, are conditions such as cardiovascular disease, diabetes, that tend to present much earlier in the lives of women, and that as a result are presenting during pregnancy. Now, this is not to say that gestational diabetes falls into this bucket, although when gestational diabetes or gestational hypertension does present, these are conditions which absolutely need to be accounted for. But we should also recognize that women are beginning to have children much later in life. And for some women, recognizing that they may have be pre-hypertensive or pre-diabetic, or conditions that they may not even discover until they do, in fact, identify as being pregnant. And the findings are showing that these are creating for increasing challenges for women during pregnancy, and that if not caught early, can create for additional complications. And that, in fact, may create even complications during childbirth that are 2 times more likely than that of a normal pregnancy. Coupling these complications with some of the other realities that transcend during pregnancy for many women, it's necessary for us to really begin to examine the greater benefit of addressing these issues very early on. On the right side of this slide, what I have outlined for you are some key components that we need to be able to take in consideration, and that when we leverage digital technology can help us to address. The first of which is this higher risk of negative outcomes for children due to the loss of their mother. I think it's without saying that there's huge devastations, but one of the things that people fail to talk about is the reality that children who are born motherless are less likely to finish their school. That children who are born motherless tend to suffer from clinical depression. And for some, research has even shown that they may, in fact, have social, behavioral, and even sexual behavioral challenges as they develop. And in some countries, particularly those countries with fewer resources, even the likelihood that the child itself will survive up to year 1 is compromised by the loss of the mother. Let's talk about what it means when a mother is fortunate enough to survive. And this is something that I think really is worth noting, because as I mentioned earlier, for every fatality, there are 10,000 plus more morbidities, injuries that women have to deal with that result in an economic impact. These include the higher cost of pregnancy overall. In fact, women who present with preeclampsia are likely to face expenses related to their pregnancy that are 3 times higher than the cost of that of a normal pregnancy. It results in delayed return to work, which has significant financial impact on the family. And as many of us know, is a great point of debate today. Many women do not receive leave, maternal leave. And as a result of this can have a significant burden on the family and also on the economic state of the states in general, as these women and their families become dependent upon the welfare system. The other harsh realities of this are the adjustments the families need to make, the potential loss of jobs and job security. And then one thing which, again, we should be beginning to put more emphasis on is this maternal mental wellness that is impacted. Not only the maternal mental wellness of the mother, but also that of the child and partner. So we have to look at some ways to deal with the situation. And one of the things that we have found, and many have found in the research that has been presented, is that by focusing in on accurate documentation and standardizing indicators for tracking maternal mortality, and I would argue also maternal morbidity, are real keys to beginning to address these issues. For one main reason, one key reason, is that it allows us the opportunity to begin to prepare for and anticipate the influx of patients requiring care. It also allows for us to safeguard against challenges that occur. One example I'm going to give of this is the notorious case of a woman presenting postpartum in the emergency room, where she complains of a headache. And then instead of being tested, having her blood pressure checked, or even asked or inquiring whether she has recently given birth, she is instead turned away from the hospital facility. And as a result, then later comes back with greater complications, and in some cases in fatality. These are common scenarios that have occurred. By creating this education and tracking around these types of rates, we're able to use this information to create for greater education and preparedness within hospital facilities, as well as in urgent and acute centers as well. But we want to do this in ways that are ensuring for quality of data and simplifying the process of the collection of data, and also using this data to indicate more effective measures for care, and to do so in manners that create for real-time analysis. And this is where the use of digital remote technologies, digital health technologies, have an opportunity to create for many advantages that we have not had in the past. In fact, the use of technologies such as Happy Mama allows for the ability for us to not only collect this data, but to collect data in a manner that allows for us to eliminate some of the biases and discrimination often exists within the institutions that have been cited for these kinds of negative or poor outcomes. The additional thing that occurs and that we know is needed is the ability to introduce affordable as well as scalable measures for addressing these challenges. And so what we're going to talk to you about now is some best practices, some ways to approach it, and how our platform, Happy Mama, which is a biopsychosocial wellness platform, may be able to assist. And so with this, I'm proud to say thank you and to pass it along to Manish to be able to describe a little bit further about the opportunity to address maternal mortality and morbidity within your facilities. Manish?
Thanks, Fran, for sharing that great perspective on all the challenges faced by maternity care and how digital technologies can help. Let me turn the needle now a little bit towards implementation. I'll be talking about three topics. One, we'll throw some light on the best practices that you can keep in mind as a health system or as a practice before you embark on a digital healthcare or RPM implementation journey, and make it successful for the maternity care related issues and challenges. Then we'll introduce the Happy Mama solution and how the Harman connected care platform, that is Harman RCP, is powering the solution and enabling the the health systems in delivering remote care experience for maternity care. Talking about best practices, we all understand that successful implementation of an RPM program can really improve health outcomes. It could reduce burden on the clinicians, and it can even generate more revenue for practices and health systems and open new revenue streams. But there are challenges that we need to keep in mind. While some of these may seem obvious, but are really critical in ensuring a successful and scalable long-term implementation of any virtual care program. Guess the first 2 or 3 are kind of related and go hand in hand. When we think of starting a virtual care or an RPM program implementation, the way we work with our clients and partners, I think the first question that we ask is, who are the users, right? In the case of maternity care, it is relatively clear that we are talking about expecting mothers, but then we always encourage to go one step down and discuss which what type of pregnancies are we talking about here? Are we talking high-risk pregnancies, maybe age-related, or expecting mothers having comorbidities, or we are talking about all pregnancies? And then on the other side, when we look at clinicians and as users, are we looking at all clinicians? Are we looking at big hospitals and health systems, or are we looking at practices driven at a small scale and the kind of challenges they face operationally and otherwise? And are we looking at stakeholders beyond clinicians like the midwives and others? The selection of users, especially what the type of patients we are focused on, will automatically lead to a definition of the use case as well, right? For example, if you're talking about high-risk pregnancies, are we looking at hypertension management? Is preeclampsia a concern that we're trying to address in this initial phase of the implementation? Are we focused on weight management? Are we focused on gestational diabetes? Or are we just looking at an overall patient monitoring and engagement and trying to really unearth hidden challenges which can be then handled through this with the help of this program? Or we may be looking at multiple such use cases also. The impact that it will have on the overall implementation planning is the definition of different care pathways specific to each use case, and how these are then orchestrated and how the end-to-end workflow is tied, for these use cases. And then for each of these use cases, what is the objective? Clinically, what is the objective? Are we looking at just keeping the patient's vital parameters in a specific range? Are we looking at improving their medication adherence also, for instance? Is that one of the objectives? And then there are other metrics like financial objectives, operational objectives that we need to keep in mind. Right? A combination of all these will really help us define and give the overall virtual care program a solid foundation. And we can start to plan the deployment and the next steps for this implementation. Of course, financially speaking, who will pay for this is a critical component of any virtual care program. One of the key challenges or the most important factors that determines the success or failure of any virtual care implementation is the workflow. Workflow is a broad topic. It really spans across multiple different boxes in the complete virtual care value chain. But we'll maybe talk about a couple of them. The first one being the choice of having a standalone virtual care implementation versus a fully integrated implementation into the provider's health system, into the EHRs, and having an integrated workflow. Right? The standalone implementation is easier to start, easier to get off the ground. There are some obvious advantages. You don't have to get into complex IT integrations and so on and so forth. But it may suffer with some adoption challenges, especially on the clinician side, because they will have to deal with different systems at the same time, or multiple systems at the same time. Similarly, the integrated approach is really cumbersome to start with, requires a lot of planning, defining integrated workflows, ensuring implementations at multiple levels of the technology stack, and then getting it off the ground is a big task. We recommend looking at these as just evolution of the implementation process, and not really as either or. And the way we typically advise our clients and health systems is to start with a standalone implementation, but also plan integration in parallel. So we are thinking about long-term success right from the word go. Of course, it depends on really at what stage you are in your virtual care implementation journey. The second critical aspect is about the experience towards the patients. Whether we want to really give them a managed white glove service, using a fully packaged kit, including all the medical devices and other other bells and whistles, including connectivity and a hub, which is provisioned for them, so they can simply turn it on, maybe enter a PIN and start to use it, or go for maybe a less expensive option, but requiring some additional work from a patient perspective, either buying their own devices or entering data manually. Again, there are pros and cons from a usability versus cost perspective, and that's something that we can determine depending on really, again, the population that we are targeting. If we are looking at patients who are well insured, have the ability to pay, and there are options available from a reimbursement standpoint, it's always better to go with the managed kit approach. Otherwise, the BYOD option is available as well. And then there are issues that we need to think of, from a stakeholder awareness, training, and adoption perspective. No matter how good the platform is, no matter how easy the user experience is, adoption has been a big challenge always, and it's always better to set clear expectations with the patients, with the clinical staff, train them, give them all the required material, so they can play with the system, so to say, and get comfortable before we scale it up, and any chinks in the process can be fine-tuned early in the process. And last but not the least, thinking about the continuous evolution of this whole process is critical again. Not just what we are doing today, but what we may need to be doing 4 or 5 years down the line. Healthcare technology is moving at a breakneck speed, and we need to really make sure that we are able to analyze the results, pivot, adopt new technologies, and also scale as we move along. Talking about scale, this gives me a good segue into introducing Harman and what we bring to the table before I introduce the Happy Mama solution. Harman is a global connected technologies company. We are present in more than 30 countries and very focused on technology and product engineering as a means of delivering digital transformation for our customers. We have multiple businesses, and I'll talk about our healthcare practice and business and focus area in particular. At Harman, we believe that we are building lifeware and not just hardware and software. Harman's expertise essentially involves bringing the technology elements of hardware and software together to deliver human-centric experiences. We truly believe that if we develop solutions which are centered around human experiences, technology can really transform everyday experiences, and we can make a meaningful change with the technology that we bring to the table. Quick snapshot of the Harman healthcare practice. We've been doing healthcare for over 20 years and have many firsts to our name. We've been deeply involved in product engineering of medical devices, data platforms, digital therapeutic solutions, and many other systems for healthcare and life sciences market. Think of the first FDA-approved digital pill that we co-developed with one of our partners. A VR-based digital therapeutic platform for children and young adults with autism. Again, based on our connected care offerings and the first in its segment, or the other spectrum of data analytics and processing, petabytes of data every day to bring about insights and analytics from that data is something that we do all the time. We'll talk a little bit about the Harman connected care offerings, and Harman RCP or Harman Remote Care Platform is our flagship platform in the space. Harman RCP is essentially a selection or a set of tools that can enable any virtual care ecosystem. Think of this as our platform approach to virtual care. What this does is it brings a lot of capabilities to be able to monitor the health and well-being of patients, including collection of their vitals, monitoring of their symptoms through our EPRO capabilities, having the ability to engage them through patient education, videos and other resources, driving medication adherence for these patients, and overall giving them sort of an interface or a digital front door into the virtual care world, which they can use to seamlessly be a part of the virtual care value chain. And then on the other end of the spectrum, we also have the ability to manage all this data that we are collecting from patients and manage it securely, of course, ensure all the regulations and data privacy aspects, and give this data, make this data available to the clinicians in a meaningful way, so they can keep an eye on their patients and take timely action. Overall, the way we package this platform is in many different ways. The core technology stack is used to develop solutions like Happy Mama and other ready offerings for virtual care market. And we bring the power of our ecosystem, our set of EHR integrations, our partners like American Medical Association and the American Heart Association in collaboration with REACH, and many other products and platforms that we have at our disposal. We bring all these things together to really, have a state-of-the-art platform which can be used to build solutions like Happy Mama. That kind of brings together a foundation of all the virtual care experience that we design and develop. With that, let me jump into Happy Mama and talk about some of the key capabilities and features that this platform offers. Like Fran described, Happy Mama is our wellness platform for maternity care. This is the world's first biopsychosocial platform focused on maternity care. And the reason we say that is this is not just meant for remote patient monitoring, but it goes beyond that. Of course, it can help clinicians keep an eye on patients' vital signs and symptoms, and they can focus on clinical use cases like hypertension management, diabetes management, and so on and so forth. But we also offer many tools and capabilities to enable spiritual and mental and emotional well-being of these expecting mothers, and providing them resources that we have at our disposal so they can use these and benefit from these. If you look at the solution and how it works from a patient perspective, the Happy Mama mobile app is the patient's interface or a gateway for their access into this whole ecosystem. It can facilitate or orchestrate the overall virtual care journey for expecting mothers. Offers tools like a dashboard which can give them reminders about medications and when their vital measurement is due, or keep them informed about their overall adherence level and how they need to improve, and also in general share facts and announcements related to the events that we keep on organizing from time to time. It can, of course, help with vitals monitoring. We have an array of smart medical devices which are Bluetooth enabled. It can capture data through those medical devices and in a sort of an automated and seamless way pass on that data to our platform. It can also perform mental health assessments through our EPRO feature, and medication adherence and engagement is also part of the application. The application also provides maternity care specific tools like a kick counter that you can use or the patients can use. It's a very handy tool to be able to track and measure your kick counts, and also store them and make this data available to the clinicians for reference later. There is a set of partner tools and applications that are also integrated as part of the application. We believe in the power of the ecosystem and leverage our partners like life coaches on fitness and therapists and other partners that we have to enable us to offer all these capabilities through one single platform for our patients. Last but not the least, I'd also like to mention that we bring content from American Medical Association and American Heart Association also integrated into this. So depending on the condition that an expecting mother may be facing, they have automated and ready access to all the content from verified sources like the AHA, which keeps them informed of how to take care of their health better and in a sense empowers them to do so. The platform can run in a standalone fashion, which means we have a rich suite of capabilities on our Happy Mama Clinician Portal. This is again a window for the clinicians to get access to all the patient's data. They can look at all the patients they have at their disposal, see their vital parameters and health assessments that we have run for them. It can also enable them to define care plans or care pathways for different patient groups and assign those care plans to them and kind of monitor their progress. Of course, the platform offers the ability to integrate into EHR platforms and offer integrated, seamless workflows. We are already integrated with more than 60 different EHR platforms, big and small. From a US market standpoint and across the globe as well, the platform offers APIs for standards-based integration with different healthcare IT systems. Overall, the platform is focused on bringing a rich ecosystem of devices, platforms from partner organizations, and all the other contributors to this solution, and enable the vision of Save Moms and Happy Mama that Reach has set out for the maternity care and expecting mothers. Quick word on how this service is delivered to the patients. There are different models that we offer. Managed kit is a model where we want to offer a kind of white glove service to the patients, have pre-provisioned ready kits, including medical devices, a hub, connectivity, and the ability to monitor the kit remotely, update it remotely if needed, and giving a seamless experience to the patients all the time. So they don't have to worry about technology, simply take their blood pressure measurement and the data is picked up automatically through the system and made available to the clinicians. And we have a sort of a less expensive BYOD option as well for more digital savvy patients who may have access to technology and connectivity and are digital friendly as well. Last but not the least, we bring content which is regularly updated through our partner ecosystem, including the AHA content I spoke about. MyFitScript brings a lot of fitness video content at our disposal that we can use, and content around mental health, lactation support, weight management, and also applications that can enable community support through peer groups that you as a patient can talk to and exchange ideas and information and be a part of the overall ecosystem through this application. On that note, let me conclude this and say that it was a great pleasure talking to you and sharing our experiences in the virtual care implementation space and talking about Happy Mama as a solution. If you want to connect with us, you can reach out to us We'll be at CES and HIMSS demonstrating this solution, and you can also connect us through emails, and we'll be very happy to get in touch with you and schedule a demonstration and talk more about our offerings. Thank you so much, and have a nice day.
Thank you both for such a wonderful presentation. I want to first remind everyone that you can continue to submit questions using the Ask a Question panel on your screen. We have a few questions coming in actually. The first one is, REACH has done a lot of reach. Can you share more about the study findings on pregnant women's needs?
Sure, I'm happy to. I guess I would start off by saying that you're right, we've done a lot of research, and that's because REACH, we're focused in terms of our major activities on research, education, thought leadership, and innovation. And so the findings of what have translated into the innovation of Happy Mama that you've seen today. And some examples of these findings are inclusive of some needs around clinician and clinical empathy, quite frankly. What we found in our studies, actually in three major studies, one was a clinical empathy, global clinical empathy study that's part of our Global Clinical Empathy Index, where women actually created the most amount of social media noise, if you will, in their search for communities to be able to talk about and to share their experiences with the clinical system. And of that, some of the most alarming things were that many women, in fact, over 15% of women had indicated that if they had the opportunity to change their maternal care provider, that they would. So I think that that's an indication, number one, that there's some kind of gap or disconnect between the understanding and the care that's being delivered from providers relative to the needs and the expectations of pregnant women. The other thing that was found that was also very alarming in the study that we conducted, the women's survey, which I mentioned earlier, was that there was nearly 10% of women who indicated that they felt as though their clinician did not care about them, nor did that clinician care about their baby. So for us, we're kind of in a position where we don't want to draw any conclusions. I think that that's an indication of some further deep dive that we need to do in terms of discovering what has led to those circumstances. But certainly what we are, kind of delving into in terms of correlations are the remarks that were made overwhelmingly by those respondents that they felt that they didn't have sufficient amount of information about their health conditions and that they were unfamiliar with, other comorbidities like hypertension and anemia, as an example. So if you'd like to learn more about those studies, feel free to reach out to us. You can email us, in fact, at the info@happymama.global. And we'll be happy to provide you with more details.
Great. We have another question. Is it just a matter of having more access to doctors? What does digital health really offer?
Manish, do you want to take that one or shall I?
So let me start, and Fran, feel free to add. The access to doctors, of course, is the critical part, but then digital health or virtual health really goes beyond that in many ways. The focus of Happy Mama, for instance, is not just on vitals monitoring and mental health assessment and making that data available to the clinicians, and also sort of providing a communication channel between the patient and the healthcare provider, but is also about empowering the patient, making sure they are aware of how to take better care of their own health. They have all the resources at their disposal for them to be able to do so. These could be in the form of articles, videos, and verified content. This also, virtual care also offers various other engagement methods like adherence to medication, adherence to a particular care plan, and reminding them about how to again improve adherence. Adherence improvement results in better outcomes. That's a fact, and digital care or virtual care can really play a big role in that. And last but not the least, I think it of course brings patients closer to the healthcare provider, in a sense that all the data that is collected over a period of time can really give you a good time series view of the patient's health and well-being, and data speaks for itself. No issues go unnoticed if there are people looking for those, or the systems analyzing those issues. So yeah, it goes to all those dimensions, and can be a really powerful tool at the hands of both patients and health systems.
Yeah, I would like to add to that. And Manish has some very good points, right? So self-care, self-monitoring, and self-regulation are all certainly very important elements of what can be brought with digital technology. The reality is the average amount of time that one spends interacting or encountering in the clinical setting with clinicians is very small, right? Less than 5% of your lifetime, in fact, less than 3% of your lifetime being spent in that type of environment. And truthfully, conditions that arise, generally speaking, arise outside of the clinical setting. You're not spending 24/7 in face-to-face with your clinicians. So many times things arise, they're not happening in the clinic. You're actually showing up after they've already occurred, and you're describing what has transpired. So to be able to create for that continuity of care and that visibility becomes very important. The other thing is that if we're ever going to get to a place where we're able to contain the costs associated with care, it necessitates being able to create for enabling channels for individuals to be able to self-care, self-regulate, and self-monitor. Another aspect of this is that with digital technology, and in particular, I can't speak to all technologies, but I'm certainly going to speak to Happy Mama. You have the opportunity with this platform to be able to collect non-clinical data that we know is also very critical to, the impact on outcomes for women. So many of us are now within the clinical space looking at social determinant factors that are influencing the health and well-being of individuals. And the tool, because of its dynamic and comprehensive support of mental, physical, spiritual, emotional, social, economic needs, enables us to be able to collect non-traditional data that we know, in fact, is so important in being able to better support and derive at better outcomes for patients.
Thank you. We have another question. We have time for one more. There are a lot of digital health and RPM solutions. What makes this one different?
Let me start or take that one. So the Happy Mama solution is powered by Harman RCP. There are different dimensions to the solution. I'll talk about the technology and the ecosystem dimensions as well. From a technology perspective, the focus of the platform is to really bring many tools and capabilities together from our ecosystem partners, including Samsung, which is our parent organization. They have many digital health assets at their disposal, which can be leveraged as part of the platform, including tools like using wearables for continuous health and vitals monitoring, to leveraging IPs in the areas of AI and analytics that we can also leverage to bring specific condition-specific intelligence on top of this platform. And last but not the least, the integrated suite of partner applications, tools, and platforms that we bring to the table, which really enriches the platform and provides a comprehensive enabler for virtual care. That's the technology and the ecosystem dimension. Fran, would you like to add some more from an overall thought leadership perspective?
Yeah, I sure would, Manish. And first, let me go back to that technical piece, because I think something that it may be very important that we emphasize is the security and privacy element of the way that the architecture is structured is really critical. So that's, when we talk about first do no harm, we look at it from both ends, from a clinical perspective in terms of addressing the needs of women, but doing so in a manner that keeps them and their unborn child safe. But also equally, we have to look at it from the broader perspective of the security and privacy of the information that's collected, and making sure that the security and the integrity of the data is standing as well. And these are some of the reasons why REACH elected to partner with Harman, is because of its ability to bring that. But I'm an epidemiologist and public health professional by nature, so it's only natural for me to want to call out the community element. Happy Mama is more than just a technology, and we know that everybody has this unfortunately has this thing we like to call shiny object syndrome, right? See something new and cool and novel, and we all jump on board with it. But we know in public health, and we know in the adoption of digital health technologies, that it's not sufficient to use something for a short period of time to be able to utilize it for the full duration of the time that it's needed. And for pregnant and new mothers, that time period can span as long as 24 months. So how do we keep women engaged? One of the main ways that Happy Mama goes about doing this is really around creating a community. And it's through this community in which we're able to support one another, provide for access to credible information from reliable sources that the medical community itself looks to, is very important to us. And the other aspect that's really key, that's differentiating for this platform, is the ability for us to support multidisciplinary teams, not just obstetricians and gynecologists, but from every skill that has opportunity to deliver care to a patient. So even beginning with your health educators and doulas, your midwives, OBGYNs, and also, your maternal fetal medicine specialists. There's something for everyone inside of Happy Mama, inclusively bringing in support for families and dynamics such as access to transportation when transportation is needed, or to be able to address some of the harsh realities that exist for some women. For example, being able to provide support in the event of domestic violence or job loss, being able to provide access to those resources. So it's a very dynamic tool, and we're extremely proud of it. So again, if you would like to learn more about it, we are here to support you and look forward to seeing everyone at CES.
Amazing. Thank you so much. Unfortunately, that's all the time we have for today. I would like to invite our audience to complete the evaluation at the conclusion of today's event and share your thoughts with us. As a reminder, today's session will be available on demand through the HIMSS Learning Center, so feel free to come back and watch at any time. Thanks, everyone, and have a great day.